Good morning and welcome to our glaucoma awareness program here on Solid 100.9 FM. Glaucoma is often called the silent thief of sight because it can progress without obvious symptoms until significant vision loss has occurred. But what happens when glaucoma is not the only condition a person is living with? Many people, especially as they get older, may be managing other health challenges such as diabetes, high blood pressure, or even arthritis alongside glaucoma. This raises very important questions about treatment choices, lifestyle adjustment, and how to ensure that one's condition's management doesn't worsen another. Today, we will explore how successful manage glaucoma, how to successfully manage glaucoma in the presence of other health conditions. We'll be also understanding the risks, the do's and the don'ts, and practical steps to maintain overall quality of life. Today, our guest is a consultant ophthalmologist, Dr. Obinna Shiwobi. Doctor, good morning,
Deepa
sir.
Daluno. Good
Mm,
morning, everyone.
all right, and today we are set for a wonderful time on radio where we would share, where we would learn, and most importantly, glow. And yes, I keep saying on this program that whenever informative discussions like this is being held, I always implore that you get yourself your writing materials. Yes, you might not be a patient or someone suffering from this now, but I don't know. I'm not trying to wish anybody bad, but nobody knows tomorrow. Okay, information they say is power, and it's better to, or will I say, cheaper to prevent and better to prevent and also than curing it. So it is best you equip yourself with the right knowledge so that you are very much prepared in case of anything. Well, Doc, today let's dive into this discussion, and it's a very interesting one and very true, okay, because the human body can deal with a whole lot of things at the same time, and glaucoma is one for the eyes, and such a person who is elderly can be dealing with other illnesses as well, just as we mentioned right here: arthritis, high blood pressure, even diabetes, and so on. Okay, for people who are living with multiple health conditions, what makes glaucoma even more complex for them? Or maybe we get to start with the general overview of what glaucoma is, and you get to give answer to that question. For people living with multiple health conditions, what makes managing glaucoma more complex for them?
Yeah, thank you so much. It's nice being here again. We want to say a big thank you to Solid FM for this corporate responsibility to our people. We know we talk about glaucoma on Friday mornings when we come here, and it's good that this proper awareness is created. And I tell you, it's yielding fruit. People are coming around to have their eyes checked, and then those who come with they're visually impaired. Then we tell them that okay, no, it's just a refractive error and not glaucoma. So, in a nutshell, glaucoma is the commonest cause of irreversible blindness worldwide. With one, like he said, it's called the thief of eyesight because the symptoms come late. And any disease that symptoms come late is a very deceitful disease. It's also a deadly one. And for every disease that is irreversible, is actually not a disease you play with. So it is a disease you do. Every person needs to be proactive, by virtue of having annual eye checkups. And for those who have family history, you can even do it every 6 months just to be on the safe side. So glaucoma is commonest among the blacks. that is established. And like we said, commonest in West Africa when it comes to Africa. And coming home, in the Nigerian study, commonest among the Igbos. So it makes the Igbo man, being Igbo, a minor risk factor for having glaucoma. So, because we find that there's a particular gene we have that predisposes the Igbo race to glaucoma. Not the food, so it's genetic. It's not behavioral. It's not our food. It's not environmental. It's just genetics. So just like some other tribes also have their diseases that are predisposed to by virtue of their genetic composition. So that's just that. That makes it a very serious issue that we are here to tell our people, have your eyes checked so you don't fall under the punishment of visual impairment or blindness from glaucoma. You need to see young people blind, and you just know you cannot calculate the wasted years. You know,
Yeah.
then you now see people who are visually impaired. Like, just let me tell you, somebody came. He's now a chartered accountant. You know, and when he came with his son. His son brought him. I said, young man, how come he didn't do what you should have done early? He didn't go. He said he was trying to be somebody now. In all these years, he's trying to be somebody. Now he's a chartered accountant, and he does not have his vision.
Wow. Sad.
You know, he's badly visually impaired that he can define him as being blind.
Wow. That's
You know,
sad.
so you can see how. So and it is, you know, when we say the truth or the facts, it appears as if we are trying to frighten people, trying to make people come to the hospital, and somebody says something must kill a man. You know, something must kill a man, but let that thing that should kill a man or a woman not be something that is preventable. It becomes very annoying
Yeah.
that you were killed by something that you could have prevented. You know, so if you go blind from a preventable cause, then I don't know what to say about you. So you are the cause of your problems.
All
you know?
right.
So
And in not wanting to be the cause of your problem, it is very important that you get to, equip yourself with all of this right knowledge, and you are getting it free right here on Solid 100.9 FM. And just so you know, this is a partnership with the eye specialist hospital, TESH, in Enugu State, and we have been doing this for a very long time now, and it's the glaucoma awareness program right here on Solid 100.9 FM. If you're just joining, well, you have not missed so much, so get yourself on board, because today we are asking the questions. Okay, we know that there are some persons who are living with other body health challenges such as diabetes, high blood pressure, or even arthritis, alongside glaucoma. And today we are raising the important questions about treatment choices, lifestyle adjustment, and how to ensure that one's condition's management doesn't worsen the other one. And in the studio this morning is our consultant ophthalmologist, Dr. Obina Shiwobi. And yes, we are discussing my name, Chibike James, as well. Let's continue, Doc. Can certain medications, okay, for other illnesses affect glaucoma treatment? Let's say a person is diagnosed with high blood pressure and he or she is having the treatment ongoing, and something takes the person to the hospital. I want to go check my eyes, or I have my eyes checked, and they discover that the person has glaucoma. So do all of these emails taking one to cure one issue and starting another treatment to cure the glaucoma issues, does it affect does it affect glaucoma treatment or even the eye pressure?
yeah, thank you, Chibike. Okay, so let's take it systematically,
All right.
and then so that people will understand what we mean. So let us include hypertension, diabetes, sleep apnea, migraine, and
Yeah.
all as comorbidities, like saying co-diseases, like saying co-hosts. So these are morbidities on their own. Now, managing patients with comorbidities requires a comprehensive and individualized approach.
Okay.
There's no one pattern for everybody. It must be individualized, because there's so much. One, factors like medication burden. This patient has to take a lot of drugs. You see them as if they have a pseudo pharmacy in their house. In the morning, you can see him with his timetable, being meticulous with his medications, trying to take them. It is burdensome,
Yeah.
Now, for patients with cognitive impairment, those with Alzheimer's, motor impairment, who can't leave their hands, those with what called myotonic dystrophies, you know, those who have had a stroke, you know, it means that they will find it difficult to even put an eye drop, you know. Now, some medications interact with glaucoma medications, and that's why for everybody who has glaucoma should see an ophthalmologist. It's so important, because he's a medical doctor and he will ensure that all these are taken care of.
Yeah.
He will make sure that you are managed well. It's not. I don't treat just the eye, because I was first a medical doctor before I specialized to be an ophthalmologist. I manage the whole patient, and then one thing you do when patient comes in that you must do the blood pressure, and you don't. People say azotani, azawute, so you will need to.
For those who is not who
Yeah,
are not
so
Igbo, what does
yes,
it
so
mean?
first things first, you have to save life before I start saving the eye. First things first. So you save the life for an ophthalmologist, the eye specialist, is that the patient must be in good health first.
Okay.
If the patient is coming to the clinic, if not, if it's make sure if it was a near medical emergency, please sort that out first. Patient can be referred to the nearest hospital where the patient is stabilized before patient start talking about the eyes. So very importantly, like we said earlier, so factors like medication burden, yes, we know is a problem. Then because these medications are plenty, adherence to medications becomes a big issue. Patient may forget. These are not young people, may even for the young person who is very active doing business, looking for means of livelihood, who needs to feed his children and his wife, is also a big issue. Then also issue for the man. You think, okay, he's retired, he's now independent. He has to sort out other things. He has to take his anti-glaucoma medications. He has to take anti-diabetic. He has to take anti-hypertensive, and then you want to be sure that these drugs, there's no drug reactions to any of them, and that none of them is impacting negatively on the other health condition. So these are very important issues. You raise the point of cardiovascular diseases.
Yeah.
You mentioned hypertension. That is true. So there are some drugs like beta blockers that we give, which is the commonest anti-glaucoma medication we give. It causes it reduces the pressure. So with such, you're also going to be careful. Now, for patients with either hyper or hypotension, there's a problem, with glaucoma. So these are disease states. Adding another disease state on it, and you're trying to manage all. So you need to first educate this patient. That's the most important thing. Educate this patient, counsel this patient. Let the patient understand that it is doable, and that it is a chronic disease. It is a long life thing. When you tell people that you do this for life, and they get afraid, and I ask them, don't you want to see for life? Don't you want to walk for life? Don't you want to eat for life? I mean, why is it this for life frightening you? You already have this condition now, and it is for life. Except we take up the other alternatives to treatment, like laser, like surgeries. That's just when we are sure, okay, we are done with this one. So,
Doc, I'm glad you talked about what you eat for life, what you do for life, okay? And it begs the question, all right? How can a person who is having all of these things balance their diet and their lifestyle choices to support both the glaucoma management and other health needs?
yeah, thank you so much. So, for the diabetic, there are drugs we still don't give them because they have diabetes.
Okay.
First and foremost is that we ensure diabetes on its own destroys the eyes.
Hmm.
Yes. And we know diabetes does not cause glaucoma, but they predispose the eye to having glaucoma.
Wow.
And for those who are predisposed to having glaucoma, theirs may be more aggressive because it affects the small vessels of the eyes, and these are the vessels that feed the optic nerve. The optic nerve is what is affected in glaucoma. So if these optic nerves are before this onset of the glaucoma are already in a state in a diseased state,
Yeah.
then it causes more problem. It makes the disease more aggressive, and the patient finds it difficult to control. So controlling diabetes is so important. For the glaucoma patients, we tell them this. So we always ask you, normally we write it down, what is your blood sugar for today?
Yeah.
And then they keep a record of their fasting blood sugar, twice in a week. And when they come, they show us that record. We take a look at it, and we tell them that, diabetic retinopathy is now a leading cause of blindness in the Western world. And it's coming over to our country, Nigeria, because we are kind of almost taking over we're almost eating like them now, So for patients with these comorbidities, it must be well counseled and well enlightened. First and foremost, that they shouldn't be afraid. That this is a stage of life, and it has come. So it needs to be managed, and that if well managed, they will live a happier life. So talking to them makes sense. Tell them, yes, you have more drugs to use, and that's like more of your time you are putting drugs every 2 hours. I don't know whether you've been in a bus. You see people at a particular time, they just raise their face and then put their eye drops. You just respect them for keeping to time, because some of these things have time. So that they don't make mistakes, So it is doable, and we advise our patients just not to feel burdened. Yes, it can be burdensome, but just know that it has come. Now, what we have advised such patients at such times, if you have multiple medications for the eye, I take multiple medications for blood pressure and diabetes. Why not just do laser? Selective laser trabeculoplasty. And then once your pressure, then you can stop the medications.
Doc, the warning signs. Are there any specific warning signs that glaucoma may be worsening due to another health conditions? Because you talked about going for checkup. Yes, we get that. But then, before your next checkup, maybe something might have happened. So, what signs can someone look out for
So
to
your
understand?
vision. Thank you so much. That question makes so much sense. So your vision becomes blurry. Now you begin to have what you've not been having all this while. You find out what you could read before, you're no longer able to read it. What you could see before, you're not able to see it. Now you can begin to have floaters. There are things that come into your field of vision. You want to catch them, you can't catch them. Some begin to have pain. Some begin to have tearing. And then this tearing come from the drugs you're using. Some begin to have feeling of sand in the eyes.
Sand.
Yes, as if the eyes are, but there's no sands. Just to tell that the eyes are getting dry. From the medications you use. Then on the part of the comorbidities, the patient should also be educated. And then let me say that management of patients with comorbidities is, you must involve the other professionals. Now, for those who are hypertensive or who have cardiovascular comorbidities, it must involve a cardiologist. For those with diabetes, it must involve an endocrinologist or any physician available, because you are not managing their diabetes for them. You are managing the glaucoma, while the physician manages the diabetes or the hypertension. So you can see. So what we call it is that it is a multi multidisciplinary approach to management of a patient. The goal is the comfort and good of that patient, and is managed by multiple specialists. Specialists in each area the patient has a disease condition. In that way, the patient wins, in all battles, because he's well taken care of by multiple specialists. And in that case, the patient does not suffer. So I'm an ophthalmologist. Yes, also a trained medical doctor, but I wouldn't dabble into what is not my specialized area.
I'm glad you talk about specialities. Okay,
Yes.
just like the analysis, the assessment that you gave. Okay, if a person have glaucoma, you have your ophthalmologist for that. Someone who has arthritis also have a healthcare provider too for that. Someone who has diabetes have a healthcare provider too for that. But how important, okay, is coordination between an eye specialist and other healthcare providers? Should the reports or my reports of with this specialist, should I also show it to the other specialist so that they can be able to understand my situation better and know the best approach to go?
Yes, thank you so much, GBK. Yes, we do that. We collaborate with each other. I would normally ask you, who is managing your blood pressure? And you tell me, oh, there's one place at Ngo or at Nkano I go to. I tell you, no. Who is the doctor in charge?
Okay.
That's what I'm asking you. I'm not asking you which
Where you are
facility
doing
you
it.
no. It is not an all-comers affair. We are growing now.
Yeah.
It's not time for anybody to treat. No. For every disease, there's a specialist assigned to manage such a disease condition. So what I'm trying to say is that, do we collaborate with each other? Yes, we do.
Okay.
So when we see a patient can request for a medical report so that his doctor will see. And you ask him, when I go to see a physician, he says, okay, it's in 2 weeks' time. Oh no, it's this coming Friday. Next Thursday. So okay, good. Please tell him, look at what your eye pressures are, and their vision is intact, their visual field is intact, and that's you are doing well. And then he goes to see the physician. The physician does the same thing, and would send to me and said, okay, his blood pressure is under good control. That it appears that one of the drugs is interfering with this medication. If you can't change on your own side, we can change on our own side. So
Yeah.
you can see that teamwork helps. You and the doctor, you don't work in the same facility, but you see, because you communicate, and for a well enlightened patient, he does that go between. Do you understand? He takes this information from this doctor to this doctor, and because he's the beneficiary, so he benefits from that interaction. He encourages it. He is the one that ensures that this interprofessional communication is open, and it yields fruit for himself, who is a sole beneficiary. So I think that is actually an appropriate thing we need to do. We don't manage for patients with glaucoma and comorbidities.
Yeah.
There must be a multidisciplinary, specialist attention. It's not a one person thing. No,
Not
no.
a one person thing
And
at
for
all.
all of them who have come, I mean, patients have come for just because they are not seeing well and not able to read. I will tell them, okay, your blood pressure is high. You say, it has not been high before. It's okay. Go and check. And then from there, I mean, by virtue of that practice alone, ensuring that every patient that comes for eye checkup has his blood pressure done. Many people have found that, they even have blood pressure. And when they come, say, your pressure is on the rocks. This may be the problem you're having. The eye ache, the headaches. So let's sort this out now. Because you're a medical doctor, you bring the pressure, then now give him a referral to a cardiologist who does the needful and sends back to you. And patient comes and says, that's no more eye ache, no more pain, that he's able to see clear now better.
But
So,
Doc,
yeah.
all these things can be a whole lot, okay? And there are some persons that once you explain all these things to them, or some persons even listen to us like say, but this thing I work with, and it brings about stress for people. All right. So I want to really ask, what role does stress management play when living with glaucoma and other chronic illness?
It's okay. So, stress is something that is almost inherent in every disease condition, not only for the bearer, sufferer, but also for the loved ones around. And that's why there's appropriate counseling when the patient comes in. You know, when the patient is well counseled, well educated, well enlightened, this patient tends to do well. Do you understand? You may need to turn this stress, supposed stress, into something that is manageable. You know, now stress. You know how people say, um, don't turning obstacles into stepping stones to something greater. You know, making yourself happy. You know, and then don't get yourself burdened or worn down. We all agree it is stressful, and then very importantly, financially too is stressful.
Yeah.
You know, with poor health insurance scheme in Nigeria, it's actually annoying. You know, a patient came and then he said he's retired now, but when he was working for the government, he was having his health insurance, moving on well. I said, no, it is now you need health insurance now. Now that you're not being paid salaries, as you know, and then I don't know how the pension comes, but we also need to factor in a proper medical health insurance for every citizen of Nigeria, especially the aged, so that those above 60 years of age, so they can access health by virtue of being a Nigerian.
True.
So it is stressful, but once a patient is well enlightened with loved ones, and that's why it's good when I speak to patient, when the patient is being spoken to, please ensure that the loved ones are there too, and then ask if they came with a little child who can really take responsibility. Ask, give them your number. Let the son, the daughter, the guardian, whoever takes care of it, of him or her,
Yeah.
to call you
If there's
and get
anything.
more information. Then you educate them more. This is not a death sentence. Like somebody asked me this week, is glaucoma blindness? I said no. Glaucoma is not blindness. Glaucoma is people are going. My mom has had glaucoma for close to 25 years. I mean, and she's doing well. So she has used drugs, she has done surgeries, and then I mean she's doing well. So we are trying to say that yes, those things are stressful financially, stressful even spiritually, stressful in all ramifications. But these stresses can be well managed if patient is well educated, and we pray that our governments will do the needful in putting the right medical scheme for the aged. In that way, I think our people will not be afraid of getting old.
Yeah. Right now, let's open up the phone lines and let's start taking your calls. The numbers to call are 0704 550 2840, 0909 771 1009, and you can also call 0902 311 1009. Okay, these are the numbers for you to call to be part of the discussion this morning. And yes, feel free to ask Doc your question, and I'm sure he would be very much
Both
equipped
in
to
Igbo
answer them. You say?
Igbo or English, anyone.
Okay, yeah, in Igbo or in English, anyone you want. Doc is very much, yeah, very, very much capable of giving answers to them. So, 0704 550 2840, 0909 771 1009, as well as 0902 311 1009. Keep the calls coming in while we continue to have our discussion right here in the studio. Well, Doc, let's
Yeah,
talk about exercises. Okay?
yeah, very good.
Yeah, okay. Let's take this call before we talk about exercises. Hello, good morning to you. Hello? Can you hear me?
I did hear you.
All right, go on. What's your name?
My name is CY from
CY.
Kogi State.
All right, CY, please pick up.
So, like, which the hospital they used to go and check on that side? You get any special hospital?
I didn't get the. What did you say?
I said, like, where we people go and make that checkup?
Okay, where can someone go and make this checkup?
Okay. Okay. See what continue. Okay,
Any other question?
There's one that you say that the most people suffering this glaucoma is from Southeast. But what of these northern people where all of them blind, where they carry...
No, that one is called trachoma. That one is called trachoma. Trachoma.
Huh?
Trachoma. That one is called trachoma. Yes, trachoma is commonest.
What type of...
Yes, that is an infectious disease caused by chlamydia trachomatis. That infects that one causes a corneal opacity. You know, it's so common in the north. So that's what happened in the north. It's called trachoma. Okay. While what we're talking about is glaucoma.
Trachoma and glaucoma. Yes, so that is it. So, and he asked about
Yes,
where
we
can
can
someone...
assess. I think every teaching hospital has a department of ophthalmology. They can avail themselves of every teaching hospital, and then they also in the area. He called from Kogi. I know in Lokoja. You know, you'll also see ophthalmic clinics. You know, where he can assess. I mean, he can have his eyes checked. I know they're also in big centers in some other cities too. They also have federal medical centers and general hospitals. They also have eye doctors there that can actually evaluate their eyes.
All right. 0704550284 0909-771-1009 and 0902-311-1009. Yes, keep those calls coming in, and yes, be rest assured that you would get right and adequate answers right here on the program. So, Doc, talking about
exercises.
yes, exercise.
So,
Okay, what are those? Like say safe exercise that can help maintain general health.
Regular exercises are beautiful for the eyes, and not only for the eyes, but for the entire body. You know, it helps lower intraocular pressure. I don't know whether you know that. It improves ocular blood flow and potentially slow down the progression of the glaucoma. That is known. You know, so we encourage exercise. I think that was about first of this month. I talked about exercise. You know, as a very important aspect of lifestyle changes for those who do sedentary work. Chip, I hope you don't do sitting down from morning till night.
No,
I hope you walk around.
Yeah.
Please. So just try to walk around. Do the much you can do. Stretch yourself out.
Yeah.
You know, you can even just do jogging for about say 5 minutes, 10 minutes. You know, go back to your seat. Then try not to stay long on a seat. Even if you are reading a book. Even if you are, you know, tend to walk around and then tend to, you know, do the exercises that you can do that are helpful. That this is known, you know. So, but we can also say those ones that involve straining.
Yeah.
Some yoga may cause, you know, any exercise that the heart is above the head will increase the intraocular pressure.
All right, let's hold on. Let's take more calls. Hello, good morning.
Hello, good morning, speaking.
Yes, good morning to
morning,
you,
sir.
I agree with you, sir.
Good morning, sir.
Okay. Some problem is that I complain that.
Can you? What's your name? And can you speak up? What's your name?
Okay, my name is Soja.
Your name is what?
Soja.
Old Soldier. Okay.
Yeah.
Okay, my own problem is that anytime I sleep in the afternoon, when I get up, I will not be happy. I know the eyes just like just a close more.
Okay.
Because I having glaucoma. Anytime I sleep in the afternoon,
Mm-hmm.
and coming for night, if I go full sleep for night, it not pass 1 hour for the whole night. No sleep again to daybreak. It's 4 or 5 years old this my eye started.
Mm.
I don't know what I will do about it.
Okay, sir. Also, when we talk
Yeah.
about sleep, we ask you how many hours do you sleep in a day? If you take up those sleeping hours during the afternoon, at night,
I don't sleep for afternoon. No pass higher for 1 hour or 2 hours.
okay,
But
then
every
at
time
night,
I sleep, get up. It will be very dark. Everywhere will be dark for me. And they think they are affecting my head. And that brain leading from my head to ear, it just affect me so much.
so also, you are saying that you sleep, let's say, about an hour during in the afternoon, hmm? And at night you don't sleep at all.
And at night, I only sleep higher to 1 hour, but for afternoon, I can manage like 1 hour or 2 hours.
So in a whole day, you sleep for about 3 hours, let's say maximum.
Yes.
It's okay.
Yes.
It's okay. It's not. I think something is wrong somewhere in the sense that you actually need to be seen and counseled, and then know what actually keeps you awake at night. Obviously, from what you're saying, the mind is not happy. So when the mind is not at rest, and then you keep going through things over the night, I don't know how you will sleep well. But ideally, you should sleep. So I think you actually need to come to the hospital to see a doctor. We need to see you as soon as you can, and then understand what is happening, and then know how to address the situation so that you can have your sleep and then enjoy your life.
All right, you heard it also, Ja. Yes, sleep is very important, okay? But then sometimes it seems if you stress the brain if you no sleep properly. 0704550280 0909-771-1009, and yes, 0902-311-1009. More calls right here. Hello, good morning.
Good morning.
Good morning to you.
Good morning.
Good morning.
I'm Mr. Lawrence calling from Oju River.
Welcome, Mr. Lawrence.
Please, I'm suffering from glaucoma for the past 10 to 13 years now. I've been using drugs. Please, I would like to visit Dr. Binna to see what they can say about my eyes. But I've been going from one place to the other.
Okay, sir. Okay, sir.
If you can send this number. Send this number to me.
Okay,
Please,
if you're with your phone, Mr. Robina, hold on. If you're with your phone, Doc at the end of the program would call out a number for you to reach out to.
Please, when calling the bill, please take it to so that I can catch it, please.
Oh, no problem. I'll do that.
Right, you're welcome. Thank you.
All right, thank you very much. More calls. Hello, good morning.
Good morning, doctor.
Good morning, sir.
Yes, sir. I'm Mr. Edet, calling from Cross River State.
Can you turn down the volume of your radio set or move away from there?
Mr.
Okay.
Ressa.
I've done it.
All right.
I'm Mr. Edet, calling from Cross River State.
All right.
We'll get to be precise. Yakko local government.
Welcome.
Mr. Ressa.
I have been trying to follow up with your program. And with some signs I used to see in my eyes. The eyes, I used to feel something in the form of sand on me. And I don't understand what that means. And secondly, in the night, I cannot look when a vehicle is coming to look at the light. I used to find it difficult, you see. And when I'm reading also, if I stop reading for, let's say, 15 to 20 minutes, if I look up, I'll be seeing somehow blood like that, you see. And I don't know what should be the cause of that. Whether it's this glaucoma of a thing I heard you people talking about, or it's cataract.
Okay, Mr. Ressa.
Yeah.
I actually think you can come to from Ugep. You can get to Calabar, UCTH, to their eye clinic and see them. We can only say you have glaucoma once you're examined, you know. But the issue of the sunlight cessation, commonest cause is dry eye syndrome, and it has to do. Comes with age, with hypertension, with diabetes, with even use of eye medications, and then with trauma. Then you talked about headlamp at night. There's nobody who is an expert at night. Almost everybody feels that, that once there's a headlamp shone on your eyes, it's discomforting. And people do not know how to dim their lights, to the oncoming vehicle, especially at night. So they keep it, full blast, and that is grossly inappropriate. Lights should be dimmed at night so that the other oncoming vehicle can see well. Because you put a full headlamp, and then the other person will not see well. So we all use the experience to drive at night. But for those who have what we call cataracts, it affects them more. The light tend to scatter, what we call glare, and give them more discomfort at night. So I think you should also, like I said, try to come. We can only say what you have when we see you. And then talked about when you read. If you read without glasses, and
if I read like 15 to 20 minutes.
Mm-hmm. Now, do you use glasses to read?
I'll start seeing somehow blonde.
Yeah. Because you are moving from near vision to distant vision.
Okay.
Yes. So I asked the question whether you use glasses for reading.
No, I don't use a glass.
Yes,
I don't use a glass.
so what happens that you actually need spectacles for reading. What happens that you are straining to read, and when you look up, because you are using muzzle to read, when you now look up, when the muscles are now trying to relax to see distances and distant objects, it's blurry, but with time it sees. Now, for you to go back to the same book again, you see that it takes you time again to read again because you start, using your muscular effort, that is trying to increase your cumulative effort to see small prints. I think, like I said, you actually need to see an ophthalmologist so that they will know what actually the problem is and so they can have some comfort. If you have spectacles, you'll be able to read and look at distances without being uncomfortable. But like I said, we can only say you have glaucoma when you are seen and when you are properly examined.
All right, thank you very much. And Doc, we just have to, wrap things up right about now. And one of the callers asked for a number to reach out to.
Please do.
All right, call the number.
Mine, okay, 080 33
08033. Okay.
94
94
21
21
47.
47. One time, one more again.
080
080
33
33
94
94
21
21
47.
47. I'm sure you got the number. Well, if you don't, maybe till next week, you can reach out to us. Doc, this is how we would wrap things
thank
up.
you so much.
Just tell us one last thing that will I say people dealing with what we have talked about just be able to manage all of this and prevent them.
Okay, so people, oya glaucoma will oya ne me made uisi ne ngwota. We've said it on over and over again about the irreversible nature of glaucoma, and that anybody can have glaucoma, and that you do not know whether you have it or not until your eyes are screened, and that it is only appropriate, just like we buy cars and ensure that our cars are serviced. We buy phone, we buy things and ensure that those things are serviced and these things are maintained. We, the person that acquires these things, should also have our body checked, not only for the eyes but for other parts of the body, to ensure that we do not die from preventable deaths. Now, visual impairment and blindness from glaucoma are very, very, very preventable, and that people are living with glaucoma and they're living happily with glaucoma because they are well managed. For those senior citizens who have glaucoma, blood pressure, hypertension, hypotension, migraine, asthma, diabetes, these things can be well managed. Don't feel overburdened. Don't feel that you can't do it. It is possible. It is doable. So we ask you that you actually need to see, but you need to be managed by multiple specialists so that you benefit the best from these specialists, and that you'll be able to manage your drugs and ensure that these drugs that you are taking, one, is not affecting the other disease condition, and that the drugs are the drugs are also not interacting with each other, causing problems to you. So we wish you a happy weekend, and we ask that you ensure that you, your family, your loved ones have their eyes checked to the glory of God. Thank you so much.
All right. Thank you, Dr. Yes, for very, very insightful lectures today. Dr. Obina Shuobi, who is a consultant ophthalmologist. And yes, this voice, Chibuka James, you know it. That's the wrap on the show for today. See you same time, same station, next week, Friday.